Hello, everybody. I'm Chris Orestes. Thank you so much for joining today's 5-minute brainstorm. It's our weekly Wednesday webinar series where we're covering a hot topic in 5 minutes so that you have some good information and some tools to carry on your week with and hopefully put into practice in your life and in your business that you'll find helpful. Appreciate you joining us today. Today's topic is 5 predictions for healthcare. 2020 was definitely a shock to America's healthcare system, and that shock is carrying over into 2021. 2021, though, has ushered in a new administration to take on the challenges this year and over the next 4 years. We have the need to administer vaccines to 300 million Americans, and for the most part, that means 2 shots. A huge logistical challenge. And we're looking at millions of Americans who've lost healthcare and health insurance coverage in this country from the shock to our economy. So let's talk about 5 predictions for healthcare in today's America. First, are we looking at a future that looks something like the healthcare Hunger Games? The question boils down to, is healthcare a right or is it a privilege? Well, the Biden administration now in control of the White House and Democratic majorities in the House and the Senate, their opinion is that healthcare is a right for all people and not a privilege. ACA, the Affordable Care Act, will not be repealed and replaced. It really has settled in as a key component of the fabric of America's healthcare system. It's been in place now for a decade and now going into its next decade. So look to the ACA to continue to grow, expand, be built on, and for it to continue partnering with Medicaid in the states as another method to expand coverage, particularly for people in low income categories. We're also looking at the aging of America's population. There's a real silver tsunami that's been hitting this country really in earnest for the last decade and more since the baby boomers started turning 65. And what's interesting is for the first time, America's aging population is actually now outpacing birth rates, which are declining in this country for the first time. And that's going to be an interesting dynamic to have to grapple with, because if you have an aging population that is consuming resources, particularly in retirement and healthcare, but a declining population of young workers to pay in with taxes to support that, that is going to have to be addressed. And that's become a very serious consideration for our country. You now have 10,000 baby boomers who are turning 75 every day. And that's putting a lot of pressure on Medicare, Medicaid, and Social Security to keep up. And it's going to require some serious action to protect their long-term solvency of these programs. So we're really looking at a very big emphasis over the next few years in entitlement reforms. Consider Medicare spends $859 billion in 2020. Medicaid spent $604 billion in 2020. And Social Security spent $1 trillion in 2020. Those are not numbers that are going to go down. Those are numbers that are going to increase. So we have to look at the fact that over the next 20 years or less, all economic projections based on those demographic realities are that these programs are definitely looking at potential problems with their future solvency. So you want to be looking for, and you're seeing the talk already, and it will continue, that these programs and their solvency are going to need to be addressed with tax policy, eligibility criteria. Are we looking at potentially raising the age for people to be eligible to get onto these programs? More cost sharing in Medicare and Medicaid, and always more emphasis and more incentives to grow private market solutions to help people address their healthcare needs, their long-term care needs, and to do more to save, invest, and be better financially prepared for their retirement costs. Also, employer-based coverage is under a lot of pressure. Right now, this is the primary way that families in this country get health insurance coverage. At the beginning of 2020, we had 158 million people who were getting their health insurance coverage in an employer-based model. But based on what's happened in 2020 with the pandemic and its impact on the economy, 15 million people lost their employer-based health coverage. And that employer-based health coverage is for more than half of people under the age of 65 in this country. And then for people 65 and above, that's where Medicare kicks in. So with the definition of what employment is going forward in a post-COVID world changing, the fact that so many people rely on group coverage, employer-based coverage, is really a critical part of the equation that's going to need to be addressed. How do you continue to get employer-based, group-based coverage to people if less and less people are going to actually be employees showing up at offices? This changing dynamic is going to be one that is going to be top of the list of what has to be addressed to get people the ability to be covered. And we have an exhausted healthcare system right now. COVID, over the last year, has really revealed the limits of our healthcare system's ability to deal with a catastrophic level event. You know, what we're watching now with hospitals maxed out, needing to spill over and provide treatment in sport stadiums, in other venues, in what it's done to the workers in the system, and just maxing them out, pushing them to their absolute limit, up to now with months still to go, and maybe some of the hardest months still to come, has shown us that our system, it can only take so much, and the ability to handle future catastrophic events, whether they're pandemic related, related from other unexpected situations that can come from natural disasters, potential other events such as terrorist attacks, let's say, is something that really will be addressed very, very strenuously by the administration and Congress and in the states. We can't find ourselves in another position where we can't meet the need for basic medical equipment, PPE. And now we're going to watch the limits and the challenges that come with producing and distributing a vaccine to get out to people as quickly as possible. So the healthcare system's weaknesses are really being revealed through this event, which will necessitate a lot of change and adaptation to a world that's changing around us. You're going to need full-scale government involvement at levels that it took to do things like win World War II and to get out of the Great Depression. Just private market by itself, people by themselves, states by themselves are not sufficient to take on these kinds of challenges. And we're witnessing today the results of that. And you're going to see a major harnessing of government activity, government military intervention into how to grapple with getting out of the current situation. And then what are we going to do dealing with it going forward? This is also probably stressed out healthcare workers to the max, and there's a fear that we'll be losing healthcare workers, people quitting the field, people avoiding going into that field. We can't be losing healthcare workers at a time when we need them now and in the future more than ever. And we're also seeing tremendous stress on rural healthcare systems. That's a major challenge to our healthcare system going forward. We're going to need to improve what we're doing about stockpiles of materials and also eliminating our reliance on foreign supplied materials, which was revealed to be a real Achilles heel for our system when it came to PPE, ventilators, and other materials. We can't find ourselves in a position again where we're relying on foreign governments and their ability to get materials to us that we need to take care of our own national interest, our own people. So look for the impacts of COVID to have a very lasting impact on our healthcare system going forward. It has revealed a lot to us about insurance coverage, about treatment, about supplies, supply chains, workers, also grappling with things like misinformation. How does social media play a role in all this? There's so much that COVID has shown us. And in many ways, I've said to people, and I've said in the media, you can kind of look at COVID as a dress rehearsal. In a way, we got lucky that this wasn't a more virulent situation, a higher mortality rate than what we've experienced, which is already an unthinkably high mortality rate. But imagine if the mortality rate on this was a higher percentage of people infected, what we might be going through right now. So in many ways, this has been a dress rehearsal for more serious situation that may come in the future. And with these weaknesses in our system revealed, challenges coming from an aging population, challenges coming from how are we going to sustain the safety nets that we prop up our most vulnerable populations, the poor and the seniors in our country, you're going to see a very active discussion and movement in the direction of addressing these things so that we don't get caught short again, we don't let critical systems become insolvent, and we don't let down not only the most vulnerable people in our society, but all of us across the board that rely so much on a well-functioning healthcare system. And now more than ever, you're going to see moves to improve and address the weaknesses and the inequities in our system. So I want to thank you so much for joining me today, our 5-minute brainstorm session on 5 predictions for healthcare. As always, we love working with you, talking to you. We'll follow up with you after today's webinar, get a recording of this out to you, other materials to be working with us, staying in touch with us, and we look forward to when we talk to you again soon in the future. Thank you so much for joining us today.